Welcome to this explainer. Today we're taking a real deep dive into a framework that's, well, it's going to fundamentally change the way you view your own body. Most of us have been taught to think about health strictly in terms of genetics, diet, stress, maybe sleep and exercise. We tend to look at disease through the lens of bacteria or chemical imbalances. But today we're exploring a radical yet actually profoundly ancient perspective from gastroenterologist and researcher Dr. Brennan Spiegel. He argues that the human body is engaged in this constant, invisible war with a force we entirely take for granted, and that's gravity. It turns out many of our most common, frustrating health problems are actually symptoms of this invisible war going badly.
Okay, let's dive into this. What do irritable bowel syndrome, generalized anxiety, and chronic back pain actually have in common? I mean, in standard medicine, if you have these three issues, you're probably going to three totally different specialists, right? You've got a gastroenterologist for your gut, a therapist or psychiatrist for the anxiety, and an orthopedic doctor or physical therapist for your back. They seem completely disconnected. But what if they aren't? What if there's just a single unseen culprit pulling the strings behind all of them?
Well, that unseen culprit is what Dr. Spiegel calls gravity intolerance. You see, gravity is just so constant that we're entirely blind to it as a health variable. We don't feel it the way we feel a pulled muscle, right? But think about it. The average human body weighs between 130 and 200 pounds. Every single pound of that weight is being aggressively pulled downward at 9.8 meters per second squared, 24/7 for your entire life. Standing upright isn't just some passive default state for your body. It's an incredibly active, demanding project. Your musculoskeletal, cardiovascular, nervous, and digestive systems are continuously working to keep you vertical and keep your internal structures from literally collapsing into a puddle. Gravity intolerance happens when that project starts to fail. To really wrap our heads around this, we need to look at what happens when gravity is actually removed. Take astronauts in microgravity, for example. When they spend extended time up in space, freed from the need to fight gravity, their bodies basically downregulate. They return to Earth with weakened bones, muscle atrophy, digestive irregularities, and balance issues. Their gravity management systems have literally gone offline. Now contrast that with us humans on Earth. Dr. Spiegel argues that a ton of us are experiencing a modern version of this exact astronaut problem right here on terra firma. And it's not because gravity disappeared, obviously, but because we sit for 8 to 10 hours a day. We slouch. We're profoundly sedentary. Because we aren't demanding our systems manage gravity effectively, those systems just weaken over time. And when those systems weaken, we see the specific constellation of symptoms emerge. Let's look at a few. IBS affects about 10 to 15% of the global population, often with totally normal lab results but terrible discomfort. Then there's exhaustion. Your body expends enormous energy just fighting gravity to pump blood up to your brain. When that system is weak, you literally run out of steam. Back pain? That's essentially a story of gravity winning against your spine, which is of course often aided by our terrible modern desk posture. Dizziness upon standing is a literal failure of the body's anti-gravity blood pumping mechanism. And anxiety. This one is absolutely fascinating. When your body is chronically struggling with gravity, you're hunched, compressed, physically unstable, your autonomic nervous system reads that postural instability as a physical threat, so it maintains this baseline state of low-level alarm. This brings us to a massive paradigm shift. The standard medical model treats a patient with IBS, back pain, and anxiety as having three completely separate comorbidities, treating them in isolated silos. But Spiegel's systems view argues they're simply different expressions of the exact same underlying failure. The body has basically become intolerant to the most fundamental force in nature. By shifting our perspective to fix the foundational gravity resilience of the human body, a lot of these seemingly sprawling, disconnected symptoms can actually resolve together. Section 1. The gut-gravity connection. Slouching and serotonin. Let's move to this next part and see how this builds by looking closely at one of the most underappreciated victims of gravity, and that's your digestive tract. Think about your digestive tract for a second. It's roughly 30 feet long, coiled up right there inside your abdominal cavity. It relies on these coordinated muscular contractions called peristalsis to actually move food through. Now, when you're upright with good posture, the gut has its proper geometry. But think of a kinked garden hose. When you sit and slouch for hours on end, your spine curves forward and your abdomen compresses. Just like kinking a garden hose stops the water, compressing your gut literally slows or stops the movement of food. Gases accumulate, the microbiome gets disrupted, and what's worse, the gut starts sending distress signals right up the vagus nerve to your brain, which directly influences your mood and stress levels. Now, what's really interesting about this is the sheer scale of the data.
When we hear the word serotonin, we immediately think of the brain, right? The happiness chemical. But shockingly, a staggering 95% of the body's serotonin is produced in the gut, not the brain. Down in the intestinal lining, serotonin regulates those muscular contractions that move your food. But here is Dr. Spiegel's absolutely crucial connection, that gut serotonin is also intimately tied to your physical strength and muscle tone. Low serotonin in the gut doesn't just mean sluggish digestion. It biochemically means you have a body less capable of physically holding itself up against gravity. So how do we actually fix that? Well, we eat for gravity. You see, serotonin is synthesized from tryptophan, which is an essential amino acid your body just cannot make on its own. You have to eat it. Dr. Spiegel introduces what he calls the Stack 10 diet. This basically involves eating tryptophan-rich foods to give your body the exact raw materials it needs to naturally support serotonin production. And this is a profound reframe of how we view nutrition, right? You aren't just eating for calories or macros anymore. You're literally giving your body the biochemical resources to stand up straight under the crushing weight of gravity on Earth. Section 2. The Action Plan. Tools for Gravity Resilience. Okay, understanding the theory is one thing, but how do we actively fight back? The number 10, this is your very first tool, and it's a diagnostic test you can actually do in your living room right now. Can you stand on one leg and balance for 10 seconds? I know it sounds trivially easy, but for an increasing number of people, especially as we get into middle age, it involves wobbling, putting the foot down, or needing to hold on to something for support. Studies show that the inability to balance on one leg for 10 seconds is a massive, statistically significant predictor of all-cause mortality in the following decade. It is a pure test of your body's gravity management capacity. We're talking your proprioception, core strength, and neurological coordination. If you can't do it right now, that is your first goal. Practice it daily. I promise your body will adapt. Tool number 2 is the dead hang challenge. It's exactly what it sounds like. You simply find a pull-up bar, grip it, and just hang there, letting your feet come completely off the ground. The goal here is to build up to 1 full minute. Why does this work so well? Well, physically, it deeply decompresses your spine, directly counteracting that intense compression that gravity and sitting create all day. It opens up the shoulder capsule and activates your core. But psychologically and physiologically, it is a literal act of defying gravity. You're taking your full body weight and training your structural muscles to absolutely refuse to fall. All right, here is our next target number, 13. Specifically, 10 to 13 glasses of water a day. Now, this isn't just some generic wellness platitude about staying hydrated. I want you to think of your body as a complex system of vertical pumps and tubes. Your heart pumps blood, your gut moves food, your lymphatic system circulates fluid. All of these require adequate fluid volume to flow upward, fighting against gravity. When you're dehydrated, your blood volume drops, the vessels constrict, and your cardiovascular system just has less reserve to fight gravity when you stand up. You know that mid-afternoon exhaustion or dizziness? It's often just your internal pumps failing to push fluid upward because they literally lack the raw material. So drink your 13 glasses. If you want to literally train for gravity rather than run from it, you might want to consider the weighted vest. Dr. Spiegel recommends wearing a lightly weighted vest during ordinary everyday chores. You know, doing the dishes, walking the dog, vacuuming. And this brilliantly illustrates how safely increasing the effective gravitational load on your body forces it to adapt. You're essentially practicing life on a slightly larger, heavier planet. It forces your postural muscles, your bones, and your cardiovascular system to work just a little bit harder. Over time, those systems adapt, and you build incredible bone density and structural resilience without even needing those high-intensity gym sessions. Next up, we absolutely have to talk about breathing because it dictates which operating system your body is currently running on. A body struggling with gravity is usually hunched over, fatigued, and breathing really shallowly into the chest. This locks you into the sympathetic mode. That's your fight or flight response. Your body literally thinks it's under attack. To escape this, Dr. Spiegel recommends a specific 2-phase vagus nerve breath. It goes like this. You breathe deep into the belly first, really letting it expand, and only then do you fill the chest. This mechanical action physically massages the vagus nerve, which immediately shifts your nervous system into the parasympathetic mode. Rest and digest. You're essentially breathing your way out of chronic, gravity-induced anxiety. So, the crucial point is how elegantly this all comes together in the Gravity Resilience Toolkit. You've got the 10-second balance for proprioception, the dead hang for spinal decompression, water for your fluid pumps, the weighted vest for bone density, and vagal breathing for your nervous system. Standard medicine, well, they want to give you 5 different pills for the ailments these systems cause, but Dr. Spiegel's model says something different. fix the foundation, support your body's ability to exist in gravity, and just watch as these sprawling, seemingly disconnected symptoms begin to heal themselves naturally. Section 3. Standing Taller, a New Philosophy of Health. As we wrap up this explainer, I want to transition to the deeper philosophy behind Dr. Spiegel's work. You know, modern health culture can be incredibly toxic sometimes. If you have IBS, you're told you ate the wrong things. If your back hurts, you're told you're just too lazy to work out your core. If you have anxiety, people say you just can't handle stress. We end up treating health struggles as these implicit moral failures. But here is the honest truth. These ailments are not your fault. They are simply signs that your gravity management systems are getting overwhelmed. You have an incredible body. You just need to consciously train it for the very heavy, demanding planet you actually live on. I really want to leave you with a thought from Dr. Spiegel himself. You were born to live here. You have everything you need to stand taller. This is a call to action, absolutely, but it's a call coming from a place of immense capability, not shame. Your body is highly plastic. It adapts. It genuinely wants to heal. It just needs you to provide the right environment, the right physical inputs, and the right structural support to win its daily war against gravity. Which brings us to our final question for you to ponder today. What is your very first step toward gravity resilience going to be? Are you going to go into the kitchen right now and try the 10-second balance test? Are you going to go drink that extra glass of water? Or maybe you'll find a pull-up bar and try a dead hang. Whatever it is, recognize that you have the agency to change how your body interacts with the physical world. Thank you so much for joining me for this explainer. Pick your first step and start standing taller today.